Now that Congress is getting serious about replacing and repealing Obamacare, it's time for them to look at something they haven't really focused on, which is how do you actually reduce the size of the nub? How do you reduce the size of the spending we do for health care by the government? And there are some very useful suggestions that I'd like to make in this video. Obamacare is, of course, in two parts. 60% is Medicaid, which is for poor people who are not young, not old, but are poor. And 40% is middle-class health insurance that people pay for through the Obamacare exchanges. About the Medicaid part. Medicaid used to be a program for the very poor. Many states required that you had to be 75% below the poverty level. In other words, if you made more than $5,000 or $6,000 a year, you weren't covered. And now Obama has required that any state that approves this, and 31 have to cover up to a third above the poverty level, which brings you up to the range of about $24,000 or $25,000 a year. Now, because you're beginning to get to middle-class people there, lower middle class, it seems to me that it's appropriate to revisit the policy that there are no deductibles and no copayments under Medicaid. I mean, there are not none. It's $4 for a drug and $8 for a hospital visit, but they're nominal. There's no reason why those couldn't be more significant. Partially, that would provide a source of revenue, but more importantly, it would limit utilization so that people wouldn't be running to the emergency room every chance they get or hanging out there. And this is a very important step. Secondly, Medicaid now covers a wide range of services that include dental, mental health, transportation to the doctor, physical therapy, speech therapy, occupational therapy, and a lot of other stuff is now covered. It seems to me that Congress should scale back that coverage, particularly for those 10 million people that are newly enrolled in the program under the Obamacare expansion, either by limiting the number of days or by shedding entire categories of aid. This effort to reduce the cost of Medicaid will be very important, not just for the cost of Obamacare, but also for the state budgets. With this kind of growth in Medicaid spending, where eventually the states will have to kick in their share, you can forget about increasing spending on education or anything else. All of our money is going to go to Medicaid, and it need not. Some of these services are definitely quite optional, particularly since no children are involved. They're covered under a completely separate program. Now, for the other 40% of the program, Obamacare, there are a package of 10 fundamental services that have to be covered in every Obamacare plan. That's in the legislation. And because of that, the premiums are sky high, and the deductibles are sky high. And everybody has to have everything, whether they need it or not. These categories include outpatient care, emergency care, hospitalization, pregnancy, maternity, and newborn care. Even if you're 60 years old, you need that. Even if you're a man living alone, you need that. Mental health and substance abuse. Plenty of people don't need that, and it's a pretty expensive thing to cover. Prescription drugs, rehabilitative and habilitative services and devices. You know, most people don't need that. There's no reason for them to pay a premium for it. Lab services, preventive and wellness services. God knows how expensive that can be. People should be able to opt out of that. Chronic disease management. People that don't have chronic diseases, why do they have to pay for that insurance? Pediatric services, including oral and vision care. Everything else is covered by the CHIP program, but this is not. And finally, birth control and breastfeeding coverage, something that a lot of men might not feel is appropriate to them. But the administration can't sell a policy that doesn't cover all of these. It's in the legislation. The special interests put it there so their occupations would get lots of funding. Congress should remove a bunch of those and limit others of them so that it would be possible for someone to buy just catastrophic coverage. Right now you can buy catastrophic coverage on Obamacare, but only if you're under 30 years old. Over 30, you got to buy all of this other stuff, whether you want it or need it or not, and you have to pay for it. So Congress should change the law so that if you just want catastrophic coverage, in case you get hit by a bus or you get cancer, okay. But the premiums for that would be minimal. People would lap that up right away. Almost everybody would want to be covered, and it would do a real public service. These changes are fundamental and should be incorporated in the Republican legislation on Obamacare. And as of now, they're not. Thanks for watching.